Okay. Do you want to get out if you don't want to be? Just if you don't want to be in, I don't mind if you are. All right. So can we talk through? Grab these each. Sorry. Okay. Just grab one of those each. Okay. What do we get for ankle mobility?
Do you want to demonstrate? Yeah, we don't know how to.
Yeah.
We just know. And then you.
Okay. Yeah. So, perfect. And what's that working? So what we're doing here is band on and pulling the ankle in and back out.
Yeah.
Is that joint, is that muscle, or is that...
Joint.
It's going to be joint, yeah. Right, so if you're... Then if you're talking activation.
So you have to work the muscle.
Yeah, but that's... If you're working the muscle, that would be stability, if you're talking about that way. Which you can do, you can start, but that'll be, we're moving into the second level. So yeah, that would be joint. If it's a joint, right, there's two things to know. The first is, you got to move it 30 times in total. Oh. Right, yeah, to kind of get some change. The second thing is, there's two ways of doing it, right? So let's start with the joint then. So, yeah, you just got to move it. So you can do that. I like the ones where you can draw like the numbers. I rather numbers than circles, because sometimes the circles, say if they don't want to go into like that element, they'll just keep kind of flicking through that. Okay, another one then is, you're going to take a dowel that we have here, put it on the outside of your baby toe, so just at the metatarsal of the baby toe. Can we do this? We'll set up. Now, we go on the outside then, because, can you see here, so if I lock up, if I come here and I'm tight through my ankle, you know, I'll just collapse through my foot. So this just goes flat. So better to do it is on the outside here, bring the knee to the outside back in, keep the heel down. Good, knee to the outside, heel down. Okay, so how many times do we have to do this? 30, excellent. So we could do like 2 by 15. Now you see, what's wrong with the way Michael is doing that? Do it one more time.
Inside, the outside.
He's doing the inside, and his heel is lifting. So you got to keep that heel down because you want to target that. So again, what's Michael doing wrong there? Now?
Back leg's not straight.
Has to go outside, yeah. And you can see, just do it one more time, Michael. Go on inside. Because he's tight, so you see the way he collapses through his arch and his heel lifts. So if he's collapsing through his arch and his heel is lifting, you need to lock the ankle plate in place. So the knee has to come on the outside of the dowel, the outside of the dowel. So you're coming on the inside there. Sorry, what was your name?
Emmanuel.
Emmanuel. So you see, yeah, you want to go the outside, Emmanuel, and we're coming here. Good. Okay. So we can do it now. That's if we come to the barrier. So we're going to where it gets blocked and back off. That's a phase 3. So what you're doing is you're coming to where it gets blocked, coming back off. To where it's blocked, coming back off. Okay, that's where you'd start with any of these. Now, if you want, you can do a phase, or a grade, sorry, it's a grade 3. If you want, you can do a grade 4, which is keeping the heel down. Go to where you can't go any further, and then you just pulse a little bit more into it. So you go way smaller movements, keeping the heel down. Okay, so I'll do that from the side. Here. Okay, come in here, pulse, and back down. And then we do that 30 times. Okay, other ones then you can do, as you were saying, like a bit of activation, like heel drops, heel raises are good here for mobilization. Drawing the numbers 1 to 10. Okay, they're the ones I have for the joint. I'm just going to show, I like the band ones that you were doing. Thanks, Manuel. Okay, next ones, there's two more, is it Hannah, is it? No. Yeah, Hannah, do you mind if I use you for a second? Okay, do you mind lying on your stomach, Hannah?
Like this way?
Head up that way, perfect. Okay, I want us to practice these. So in second, I want you to, like, say Paula might take the guys, Michael, Emmanuel and Mark, talk them through how to do the joint mobility one and make sure they're doing it correctly. What are the key faults that you'll see when they're doing the joint mobility? Heel lifting. Second one? Knee, where would the knee go? Inside, yeah. You need to keep the knee on the outside. Otherwise, what they'll start doing is, because if you can imagine, right, sometimes people turn their feet out in a squat and knees buckle in. Now, one of the main reasons that occurs is because they can't actually go straight down and move through their ankles. So, if you let their knee, if you come on this side, they're just going to do basically the same thing. They're going to collapse through their arch and move their knee in, because that's what they're used to. So we need to go this side. It keeps the knee where locked out, and it keeps that arch. You can see if I'm here, see how much my arch is flattening? Where if I'm on this side, it just locks up the arch, so all the movements occurring at the foot. Now, so next one then is P and F. You can have lads doing this together. You bend up, you ask them to push down, you feel to where the stretch is, then they push into your hand. Push up here. Good, yeah. They push for 6 seconds and relax, and then you move further into it. Is that okay? Now again, you can just have it that, so say we do that, you can hold it for between 7 and 15, then they push again, relax, okay? Thanks, Hannah. Look, let's just do a bit of the P and F. We can try it for hamstrings as well. Open hamstring stretch, they push down, they come back up. Is that okay? Okay, the next one, so that's P and F. You go to where you feel a stretch, they push up, you say then relax after 6 seconds, you move down further into it, you hold that new one. The next one you can do for your for the ankle is static stretching like we have. So if it's a squat or lunge you're struggling with, it's the soleus you need. So you're going to go just bend the back knee. As I said, honestly, the best results I'd have here are just holding that for like 2 to 5 minutes. I know people say, if you're going to do a static stretch as well, this is the key way you want to do it. You can't have, sometimes you see the muscle shaking. What that is there's muscle spindles in the muscle, and they're overactivating. They occur when it's like if you stretch too fast too quickly, and it's basically telling the muscle here, I'm going to tear. So as soon as you let go, that'll snap back. So you just want to go to where they feel a stretch for the first time, hold it, then take a breath in, breathe out, and move a little bit more in. And then longer holds are better. Okay, and then obviously the other one, especially if there's any like knee pain, I like getting the hamstring and around here so they can actually fully lock out their leg. Is that? Then the last one that we'll do is, this is called active isolated stretching. So P and F works because if you contract a muscle, following a contraction there's immediate relaxation of the muscle. This works because you're using the opposite muscle. So if you contract your bicep, for example, the tricep has to relax off. Okay, and it's using the same thing. So with this, if I go straight, so what I'm doing is I'm bringing my own toes to my shin, and then I'm just giving a little pull at the very end. And then coming up, hold for 1, 2, pull. Hold for 1, 2, pull. 1, 2, pull. 1, 2, pull. That's called active isolated stretching. So you can also do it like they bring up their own leg. So you're not pulling up the leg, they're bringing up their own leg, and then you're just giving a little bit of an extra pull every time.
Is that for your hamstring as well?
This is for the hamstring. So what you're trying to do, so that would be hamstring.
Yeah.
So this is what I need to do.
That would be hamstring. If you wanted also, you could do bend here, just kick up and then give an extra one. Kick up, then give an extra one. Kick up, then get an extra one. Honestly, when my left knee gets sore, a lot of times I feel like if you can't lock out, it's a big, I'm a physio as well, so if I'm checking stuff for knee pain, if they're really tight through here, holding a stretch, just have them up against the wall for like 5 minutes, like both legs up, or doing this one, so they're like up, either straight leg kicking out, so they're bringing up their own leg, or they're kicking up and adding a stretch. That's a little bit more irritating on the knee to start with, the bent one here. If they had knee pain, I would start with a locked out one. Is that okay? And then lastly, you got like obviously just your foam rolling. With foam rolling, the key things here, you want to tell people, oh, I had one already. You want to tell people, look, it's going to be painful. I've had patients come into me and it's like, oh, how are you getting on with that? Say hockey ball work around the hips or foam. I don't know if we have any massage balls. I should have brought some. Just roll in the area. It's going to be sore. You're trying to find that sore spot. Holding on it then. Now they can do what's called active release technique then, so they can then, or specific soft tissue mobilization, where they're holding and then they're just rotating their ankle.
Just on the calf or something.
Calf, but you can do that, like say if you were doing it for here.
For the hip then, if you were doing it.
Hip, you want, that's why I wouldn't, for the hip I do like a massage ball. Turned out, I just literally put it into the piriformis, into the glute med, and then you can do it into the front here. And you're breathing into it. I'll send in a little video showing what I do with that one. Okay. Okay. Hip also then, so they were the ones for the calf. I'm going to get you to practice those. For the hip also, the static stretch, we can go around the hamstrings. The hip flexor, if we can come down here. The hip flexor, guys, starts in your back. Here. It goes through your stomach and attaches here. Okay, so you don't want to do that stretch that everyone does where it's like they're just super arched. Because you see, if I super